it's interesting, for example, that the number of COVID deaths, according to Statistics Canada, went up after all Canadians got vaccinated. In 2020, in the first year of COVID, we had about 16,000 COVID deaths in 2020, according to Statistics Canada. And this jumped up to 20,000 COVID deaths in 2022 after everybody got vaccinated. So there's Statistics Canada data that is really begging the question, was the vaccine really effective when the number of COVID deaths went up but considerably by 20% after so many Canadians got 2 or more injections of the COVID vaccine? We had that. We also had a startling and unexplained rise in deaths from Canadians under the age of 45. These are people, they're not dying from COVID, right? Because Statistics Canada, as well as all the provincial data, tells us that the COVID deaths, 90% of the COVID deaths are for people in their 70s and 80s and 90s, and you get Canadians under 45. It was very small numbers who died of COVID. Yet the death rates went up for Canadians under age 45, jumped by more than a third. So huge increase, tens of thousands of younger Canadians dying in 2022, 2023, 2024, as opposed to the pre-COVID years.
Another deeply alarming aspect of this report is the discovery of excess deaths among children, a population and demographic that typically has vibrant health, resilience, and many decades of life ahead of them, which should fuel prompts to investigate the underlying causes of this increase and the long-term implications for public health and societal well-being the longer that this crisis goes unaddressed.
What's really unusual now is we've got 1/7 of the deaths of younger Canadians are of unknown cause, which is higher than what it's ever been before. And I feel sorry for the grieving families. If I had a son or daughter, mother, father, aunt, uncle, friend, whatever, if somebody that I loved died and they said, well, unknown cause, I would be unhappy about that. And we're talking about 1/7 of the deaths in Canada are now for unknown cause.
Because this is where they show you the incident rate throughout their study period. So for non-vaccinated, you see in a solid black line, those are the cancer incidence rates that they had for that first 1 year. For thyroid cancers, all type of vaccines were increasing risk of thyroid cancers. Didn't matter which type of vaccine. Then next one would be, I believe it was gastrointestinal, and for gastrointestinal, that one was the cDNA only vaccines were specifically increasing this type of risk. Okay, now let's look at colorectal cancers, and for those it was both the cDNA and the mRNA vaccines that were increasing that risk. Next one would be, I believe next one was lung cancers. Again, cDNA and mRNA were increasing that risk. Then let's move forward. Next one would be, I believe, breast cancer. Breast cancer was the bottom two. So breast cancers were only induced by, or the increased risk that was statistically or clinically significant was for both the mRNA shots as well as the mixtures, okay, the mixed vaccines. And then finally, prostate cancer. Prostate cancer was the cDNA only vaccines. In Japan, they studied pancreatic cancers, and they were able to show that the more shots people were taking, the worse outcomes they had for pancreatic cancers. So there's that correlation here we're seeing between these observations.
Now injured Canadians are facing continued delays, denials, and in some cases are being pushed toward MAID, medical assistance in dying, as they struggle to get the support that VISP promised.
We're all in this together.
We've come so far in the fight against COVID, it's time to finish this pandemic for good. So get vaccinated. If you know someone who hasn't, talk to them. For our kids, for our communities, for our economy. It's how we get forward together.
Vaccines are safe and effective for use. Vaccines are the best way for you to protect yourself, your family, and your community. So get vaccinated. Let's fight COVID-19 together.
Pour vous protéger vous-même, pour protéger les plus fragiles d'entre nous, pour protéger l'ensemble de la population, le meilleur moyen connu demeure le vaccin. S'il vous plaît, soyez responsables, soyez solidaires, faites-vous vacciner. Merci.
We all agree getting vaccinated is the way forward. We're all in agreement this is not a partisan issue, so please get vaccinated.
We're united, and it's time to get the shot. Vaccines save lives, they're how we're going to beat COVID, and it's time for everyone to do it. Get the shot.
Get the shot.
If you'd like to find out more information on the novel modified RNA injections, you can do so at nomoreshots.ca.